surprisingly still believed by a lot of people. So without any further delay, let's get started. Hello friends, welcome to FitTuber. Starting with number 9, pubic hair is unhygienic. This is the most common misconception about the pubic hair that people have. However, studies suggest that pubic hair actually have a role to play, including preventing us from STIs, UTIs and other infections. Like any other hair, they also trap dirt, sweat and even harmful microorganisms. So as long as you wash them and keep that area clean, it's absolutely alright to have pubic hair, and of course they are not at all unhygienic. Pubic hair removal is a personal choice and it is generally safe to do so, but there may be some side effects associated with it. Well, removing pubic hair is like running a car without stepney. All works fine without it, but someday you might really miss it. Number 8, you don't need a condom during oral or anal sex. Well, you do. Oral sex may not pose pregnancy risks, but it's far from safe sex. You can still pass sexually transmitted infections between you and your partner. Anal sex, on the other hand, has been cited as the riskiest sexual behavior, especially for the receptive partner, by the Centers for Disease Control and Prevention, increasing the chances of getting infected by as high as 13 times. Having oral or anal sex, since there may be an exchange of bodily fluids, therefore using a condom is a wise decision. Number 7, we don't need a condom, you can take I-pill later. No doubt I-pill, if taken within 72 hours of sexual intercourse, is effective in preventing pregnancy, but note that it is not foolproof. Moreover, it is known as an emergency contraceptive pill for a reason. Medical professionals suggest that these pills are for extreme situations and strictly prohibit consuming them as a habit. Doing so, you are asking for trouble. Also, it's worth taking into account that while the I-pill does not protect you from HIV and other sexually transmitted infections, a condom does. To put it simply, not wearing a condom and taking I-pill is like not wearing a seatbelt in the car just because you have airbags. Number 6, you can get STI from a toilet seat. A common fear among people is that STIs can be passed in public places, such as through contact with toilet seats. While it is theoretically possible that some STIs could be passed from person to person via a public toilet seat, practically it's almost impossible to contract an STI from a public toilet. STIs can be caused by viruses, bacteria and parasites. These organisms can't live or thrive on hard surfaces, including toilet seats. All STIs can be transmitted through various forms of sexual activity, including skin-to-skin contact, genital-to-genital contact, or oral-to-genital contact. That said, it's still always a good idea to clean or cover a public toilet seat before sitting on one. Number 5, 2 condoms double up the protection. Just how wearing 2 helmets isn't a great idea, using 2 condoms is not recommended. Sometimes less is more, and when it comes to condoms, it's definitely true. Placing the second condom over the first one will only cause more friction and more tension. This rather increases the chances of tearing off the condom. Also, using 2 will cause the condoms not to fit correctly on the penis, leading to the chances of leakage. Fit is what matters the most, and 2 condoms one over the other definitely lead to a misfit. So it's advisable to use only 1 condom, properly wearing it. Ensure that there is no air bubble formed by pinching the top as you roll it down. Following the do's and don'ts as suggested by experts reduces the chances of condom breakage to almost nil. Number 4, I am a virgin, so my hymen must be intact. No, not necessarily. Some women will bleed after having sex for the first time while others will not. And it doesn't tell a thing. The hymen can also stretch or tear quite easily before a woman has sex for the first time through rigorous exercise, using tampons, or even masturbation. It's also worth noting that you can break your hymen without even knowing it. So don't panic if you didn't bleed during your first sexual intercourse. There is nothing to worry about. And for men, it's wise not to judge your partner if she didn't bleed on the first night. Certainly, sexual intercourse should be about acceptance, not inspection. Number 3, you don't need a condom if you are on a period. Oh, you do. According to the Centers for Disease Control and Prevention, having sex during your period increases your risk of getting or transmitting an STI like HIV. The virus may be present in the period blood. Health experts strongly encourage using a condom to decrease this risk. Regarding pregnancy, no doubt the odds of conceiving are lower during your period, it is still possible. Similarly, to think that it's okay to have unprotected sex on a safe day can put you in a mess. Of course, there are times in the menstrual cycle when a woman is least likely to conceive, but there are absolutely no safe days. Also, if you are suffering from PCOD, you still can get pregnant. In PCOD, the hormonal imbalance interferes with the growth and release of eggs from the ovaries, but you still ovulate, so experts advise using contraception and staying safe. Number 2, I won't get pregnant as my partner pulls out before ejaculation. Well, it's risky. The withdrawal method for birth control requires tremendous self-control. Even then, it isn't an effective form of birth control. Remember, sperms are excellent swimmers. Sperm may enter the vagina if withdrawal isn't properly timed or if pre-ejaculation fluid contains sperm. And it just requires one sperm to fertilize the egg. They are really small, and once entered, it can stay within a woman's body for as long as 5 days. So be careful. More importantly, the withdrawal method doesn't offer protection from sexually transmitted infections. Sexologists recommend following certain precautions if you want to stick to the pulling out method. Finally, at number 1, washing the vagina or peeing after sex prevents pregnancy. Peeing after sex is a good practice as it does help preventing UTI infections. But to expect not to get pregnant is like asking for salt at a sweet shop. That's because the urethra and vagina are separate parts of the female anatomy. As a result, peeing will not affect any sperm that enter the vagina. Even washing the vagina after unprotected sex won't reduce the risk of pregnancy. In fact, if a woman douches after intercourse, there is a possibility that it may actually push the sperm further up through the cervix, making it even easier for sperm to join with an egg. Anyway, vaginal douching is a straightforward no as it imbalances the pH of the birth canal. So these were those 9 common misconceptions about sex that we should stop believing. Did you find this video helpful? If yes, and if you would like to see another part of this video, then please give a big thumbs up. Which one of these misconceptions surprised you the most? Let me know in the comments. Check out